Hello, I'm Dr. James Bogash, expert in health and longevity, and today we're going to talk about exercise and COVID, a discussion public health should have been having from the beginning. And now, 2.5 years later, we're seeing that everybody was right who said that exercise could actually help prevent COVID cases and deaths and hospitalizations. And yet the message from public health included none of this. And many people still believe that there was nothing that they could do to alter the course. They were just at the whim. They had to hide out until we had a vaccine, and we know where that's gone, or drugs that will treat them, and none of those are terribly exciting. So, massive failure in public health's realm of dropping the ball on educating people on doing simple things that could have had a pretty massive impact. So this was a meta-analysis looking at 16 studies, almost 2 million people, 1,853,000 and some, and they found that regular physical activity lowered the risk of being diagnosed by 11%. So it actually protected them from whatever reason from being diagnosed in the first place. 36% lower risk of hospitalization, 34% lower risk of severe disease, and 43% lower risk of death. Geez, oh Pete, as much as anything, that's a huge reduction in death rate, far in excess of anything that we see from vaccinations or any drugs or anything, from something that has no downside as exercise. And it would have also lowered the risk of things like cancer and diabetes and heart disease. But instead, we kept quiet on things that could empower people to make better choices. Whether they choose to exercise or not, that's up to them. It is public health's responsibility, and arguably the government, to educate people on things that they can do to empower themselves. They did not do this and still are not doing this. So some of the details they looked at, they found kind of the cutoff, the magic number was 500 METs, metabolic equivalent. Can't remember what the T stands for. Maybe it's equivalence T's, but anyway, per week. So that translates to about 150 minutes of moderate exercise or 75 minutes of vigorous exercise. So for me, that's 3 jiu-jitsu classes. If you're walking, you're looking at 5 days a week, 30 minutes of moderate intensity exercise. It's not hard to meet, but we got to get off the couch and do it, and it would empower you and us and everybody to have better outcomes from the pandemic and anything going forward. Again, we've dropped the ball on this. I can't say that enough or strongly enough how much public health has dropped the ball on educating people about taking better care of themselves. As always, I will post a link to the study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.